Hello, and welcome to our first lecture in diseases of the immune system, or immune disorders. And here we get to learn about how our immune system should work and actually how it doesn't. Okay, and so these typically show up in the form of hypersensitivities, and we'll go over a few of the hypersensitivities and the immune disorders in this immune disorder or diseases of the immune system lecture series. All right, and so we've kind of probably all been stung by a bee or have seen My Girl and can understand that maybe bee sting isn't supposed to kill you, right? Like we get stung by a bee, we definitely want to avoid it, and we see a beehive and we run away, um, or at least I do. Um, and then there's beekeepers who just go up next to them and stuff, and obviously they, or at least they shouldn't be, uh, deadly allergic to bee stings. Okay, and if you are deadly allergic to bee stings, you would typically carry an EpiPen with you. I like the term EpiPen because it helps reinforce epinephrine, because epinephrine is in there, and EpiPen kind of looks like it also. All right, so as we can see here, a typical bee sting shouldn't kill you, but in people with a excessively high hypersensitivity to it, um, definitely this is life-threatening. And so here we can see a bee sting allergy is an example of immune response that is harmful to the host rather than protective. Okay, and that's going to be the kind of motif throughout this whole lecture series and chapter. Okay, so distinguishing between the immune system diseases, we have some immune hypersensitivities, autoimmune diseases, and immune deficiencies. Okay, so three different kind of ways we can um, say we have an immune system disease. Okay, so it could either be hypersensitivity. Remember, they're typically supposed to be harmless. A bee sting, not supposed to be disease killing. It's supposed to just make you go away. Um, autoimmune diseases. Okay, you uh, attack pieces of your own tissues because you think it's not part of their body. And then you can have immune deficiencies where you just don't have portions of your immune system. Okay. All right, so let's get into our case study. So we have a 40-year-old airline pilot, Carrie. Okay, Carrie has developed a rash, comes and goes, and when it comes, it persists for 7 to 10 days at a time. Uses sunscreen. Remember, she's a pilot, so uh, you're going to get a lot of sun, right? Um, and so largely goes away on its own, but she seems to be more concerned. And so, is she right, or should she just be more careful about the sun exposure? Well, who's to say? But it's enough to get the person into the hospital, so better order some tests, right? Okay, are there conditions that might be brought on by sun exposure that Carrie could be considering? Probably, but I don't think she's looking for cancer or anything just yet because the primary physician isn't sure, and so she's ordering a urinalysis and basic blood tests. So, um, if she suspected cancer, maybe, or lymphoma, or uh, skin cancer, she would refer her probably to the dermatologist or the oncologist instead of just ordering a urinalysis and basic blood tests. Okay, these basic blood tests come back quickly and it reveals that Carrie has proteinuria, and that's just a fancy term for high levels of protein in the urine. Some of that protein is also hemoglobin. Hemoglobin is a protein, remember? And hemoglobin is only found in the blood, so this is saying she's got blood in her urine. And she's got a low red blood cell count. Okay, So these all seem to be showing she's suffering from hemolytic anemia. And since the physician suspects that it's autoimmune, she's going to refer to a rheumatologist. Okay. And so the question is, rheumatologists specialize in musculoskeletal diseases such as arthritis, osteoporosis, and joint pain. Okay, none of which Carrie is experiencing, so why is she saying to go to the rheumatologist? Okay, well, they do specialize in the musculoskeletal diseases, but it's also because all of those are autoimmune. Okay, self-immunity regulated. Okay, so that's why she's sending her there. Okay, Carrie does not make it to the rheumatologist. Instead, seizure. As she leaves, quickly rushed to the emergency department, gets her medical history, and rheumatologist is there on call, on staff, suggests that she's got lupus. Okay, orders a pair of blood tests to confirm it, looking for antibody tests to confirm. Okay, based on the blood tests ordered, what type of reaction does the rheumatologist suspect is causing Carrie's seizure? This would be a hypersensitivity response. Hypersensitivity. Okay, hypersensitivity response, and we'll get through those and then some in this lecture series. Okay. Okay. Carrie's tests come back positive, confirming lupus, a disease that occurs 10 times more frequently in women than in men. It's not curable, and there's only therapies reducing the symptoms. Okay, so she started on low corticosteroids to control the rashes, and hydroxychloroquine as an anti-inflammatory. Okay, it goes on to say that all of this isn't really understood, but also advises her to limit the sunlight. Okay, because the sunlight may be precipitating those rashes. And again, as a pilot, she's got to maybe wear long sleeves. That's left between her and the doctor to discover what she needs to do for that. Okay, but she does follow her treatment plan, and symptoms do not return. Flare-ups will be likely, and she'll need to seek treatment. Okay, so that is lupus. That is Carrie. That's our airline pilot. And we will look at hypersensitivities and other autoimmune disorders in the next video.